We have some good friends who are hospital administrators.
We have all the cutting-edge research for pulmonary diseases.
My wife asked them, who is the best lung person in Philadelphia, period.
I think what sets us apart is the ability to take on the high-risk patient.
They said, Dr. Kreiner and the Temple Lung Center team.
Gave my family a great deal of confidence in that I'm getting the best of care.
I cannot say enough about Temple Lung Center and my buddy, Dr. Kreiner.
I love working with Dr. Kreiner. He's very passionate about the patients. He's so driven, and it gives the patients some hope.
Coming in Temple, I see extraordinary things happening here every day.
At Temple Lung Center, we routinely manage patients who are high risk.
Patients who really have no other options have been successfully treated here.
It's what really makes this a very different place for management of lung diseases.
And I think that reputation extends really across the country, not just through the region.
I think the patients appreciate the fact that these are clinicians who are interested in going the extra mile, the extra steps that may be necessary to make their lives much better.
Team is very important. It's everything. Temple's team is the best. We put the patient to the center of everything that we do. Patients first. It's all about the patients.
Temple Lung Center really is a multidisciplinary team. There's a whole host of people that are intricately involved in its success.
All of whom are incredibly talented, and many of whom have areas of special expertise. Recognizing our commitment to the population that we serve on North Broad Street, we also felt it was important to get the Temple tea out into the community. The fact that we have representatives of the Temple Lung Center out at Oaks, once the Temple tea is out there, people recognize it and want to be seen there.
COPD is now the third major cause of death in the United States. We have very novel interventions that we didn't have 5 years ago.
The work that we're doing here is directed toward an understanding of the inflammation that takes place in COPD.
Temple is the only one in the United States that has access to all three trials, trying to do lung reduction in a less invasive way than using open surgical means.
We've been doing a new technique for research, which is extremely exciting. We take lungs that patients have donated after lung transplantation, and we can take small cores or samples out of the lungs to look at the genetics to come up with new and exciting therapies for patients.
We're able to tie together basic laboratory research here at the bench with access to patients to make it possible to do the kinds of things that we wouldn't otherwise be able to do.
On any day at Temple Lung Center, you might see amazing results that might not happen elsewhere.
Novel therapies, new therapies.
Advances in treatments.
Every week there's a new discovery, and every month there's a new discovery. And now I feel like I have hope.
I'd like to thank Dr. Kreiner and the Temple Lung Center team. I'm here because they're here.
What matters most to me every day is making sure that the patients get what they need in terms of a better outcome or a better answer or a better relief of their symptoms. We're all in this together. We're all supporting each other and working towards a common goal is the thing that makes me come to work to try to achieve each day.